And
Can you just hold that
so
on him?
let's go ahead and get started. Why do we have
Like,
natural health
and
care
then
for
go over
animals?
to the TV.
Animals require the same things that humans need to stay healthy. Now, they require them in different quantities, but animals have to have proper nutrition. They need a proper functioning nervous system, and their organs need to work right and move right. And every one of you that has been a patient of mine knows that at various times, your bodies will show up that the organs need to be checked. Okay, if an organ doesn't move right, it doesn't work right. Okay, just like your knee. If your knee doesn't move right, and well, you know that.
Thank you, dear.
If it doesn't move right, it doesn't work right. You know, so we can check all these things in animals as well as people. Now, let's just look at one of the better foods for dogs. I'm not saying this is the only good one, but this is a pretty good one. It's Nature's Domain salmon and sweet potato. You get it at Costco. Very high in protein and minerals, very low in plant lectins. Now, anybody know what plant lectins are? Okay, plant lectins are the parts of plants that really protect it from insects. And all plants have lectins, but some of them have a lot more than others. So potatoes are pretty high in lectins, green peppers, tomatoes. And there's a lot of people that are really sensitive to these. Like, for example, what class of plants are they? I can't even remember right now. Potatoes, tomatoes, peppers are all in those plants.
Nightshades?
Nightshades, yes, thank you. The nightshades are particularly high in lectins, and a lot of people, or a certain percentage of people, are really sensitive to those. It can cause leaky gut in animals as well as humans. So what is one consequence of having your gut leaking? Anybody know? Anybody been in my classes? I know you know.
Anybody had it?
Yeah, like half the people that come to see me have leaky gut.
Yeah.
Inflammation.
Yeah, inflammation, allergies, autoimmune issues, all come from leaky gut. Allergies, and it diminishes the quality of the fur in the animals. So, you know, if you have a pet, you're feeding them a certain kind of pet food, and you know the fur is getting worse, that pet food you're feeding them probably is not good for them, and you need to switch over. This is a really good one. This is recommended by the veterinarian who basically taught me how to do this. And he found that this works pretty well. So what to avoid in animal food? Same thing as in human food, sugar. Why do animals don't need sugar? What do they need sugar for? Cheap cereal grains. Meat byproducts, and some of these meat byproducts are completely indigestible for animals. Glutens. I mean, animals don't eat gluten. Okay, they can develop allergies to gluten, sensitivities to gluten, just like people can. Artificial colors and flavors. I mean, we don't want these in our food, and chemical preservatives. Okay, animals don't need any of that. I mean, you ever see, you know, some lion or some animal on the African plain eating like a bagel or a donut? You don't see that, you know.
No, but if he had one, he'd probably eat it.
I doubt it. But you know, animals generally like to eat whole food, and most of the time, many times, raw food. Although I think the domestication of cats and dogs has like sort of moved them away from that a little bit. So Dr. Bill's lectin scavenger, you can get a product, and I don't carry this, but it scavenges lectins, which is really good for dogs and cats who've eaten a lot of processed food and treats. And a lot of these treats that they give animals, if you look at the ingredients of that, it's terrible. I wouldn't feed that to an animal.
That's why they like it so much.
And so cats should only eat wet food, never dry.
Yeah.
Never dry. Okay, so these are high lectin foods. Grains, legumes, nuts and seeds can be. So all foods have lectins in them. These have more. Grains are very high in lectins, which is why so many people get intolerances to those. Low lectin foods like some legumes, nuts and seeds, fruits and vegetables. Some grains are very low in lectins, okay? The most important part of natural health care for animals is correcting the vertebral subluxation complex, is what we do in chiropractic. So this is a functional misalignment of a vertebra, producing limited motion in the joint, causing pressure around the surrounding nerves, okay? This is what a subluxation complex looks like. This happens in animals as well as people. Doesn't matter, okay? Now, why would that happen in an animal? Anybody?
Accident, could be an accident, a fall,
Jump wrong.
and nutrition, poor nutrition.
Yeah. Jumping, like, here's a classic example of how this happens. They jump from a high couch to the floor.
Yep.
They jump from one seat of the car, front seat to the back seat, and vice versa. That's how a lot of this happens. And the symptoms show up slowly over time. They don't always show up immediately. So if a subluxation exists in an animal, the animal loses normal flexibility of its spine. It affects its performance, resulting in stiffness and muscular tension. So what do you think that would do to a racehorse? It'd lower its ability to run, okay?
He's a loser.
Absolutely. Reduced mobility between two vertebrae that can affect the nerves that leave the spinal cord, and the resulting nerve interference causes changes in health and the function of the tissue innervated by the impaired nerve. Now, vertebral subluxation complex can manifest anywhere in the spine of any mammal. It doesn't matter. Creates a neurological deficit and create somatovisceral disease as a result. So what would be an example? That's a big word, somatovisceral disease. What is that? Anybody know? Okay. So what is viscera? Viscera is basically organs, right?
Yeah.
So somatovisceral disease would be a disease of an organ resulting from somewhere else in the body, in this case, the spinal column, which is what you see in people all the time. A classic case of that, migraine headaches, okay? Digestion issues, menstrual issues in women, somatovisceral disease. So here's an example, nerves coming out of the spine in an animal, because this is how they are. The vertebrae on top, and then loss of nerve function. So I just threw this up here. I couldn't find one of an animal, but an animal has an autonomic nervous system just like a human. The organs are connected via nerves to the spine, so when you adjust the spine in an animal, it affects organ function in that animal just like it does in a human being. No different. So when an animal is given a spinal adjustment, their neurological short circuit is restored back to the on position so that normal nerve flow can be restored, the animal can be healed. So VOM, veterinary orthopedic manipulation, which is what I do, it's a really low force technique to correct vertebral subluxations, and you cannot hurt the animal. So how do we define, or how do we determine when a subluxation is present in an animal? You do a diagnostic pass, and I'll show you how we do this, over the spine by adjusting the animal. And you can tell in the animal, and I'll show you, you'll see it. When there's a subluxation in that animal, you'll see it. You'll see it. It won't hurt the animal, but you'll see a reflex in the animal that fast. Okay? That means there's compromised nerve root in that animal. And that there's muscle and skin movements which immediately change when you adjust them. So you do 3 passes over the animal. They'll show an immediate response. Sometimes a lot of times a dog will just sort of lay down when you're adjusting them because they get really relaxed. Horses will start licking and they'll get very relaxed. At first, dogs don't like, dogs that are a little bit jumpy, and the reason is because that makes a noise.
Oh.
It's not, I wish they made one of these that was silent, okay? But it's the noise that, it's not, yeah, they're not, it's not the pressure of on their spine. So here's some examples of problems in dogs that respond well. Like any kind of disc disease that doesn't involve paralysis, any kind of, if a dog kind of walks like this a lot, his head over to one side, it's usually a subluxation. Any kind of lameness, shifting lameness where their forelegs are lame, rear leg lameness, where they have a trouble getting up and then they limp. That's almost always a subluxation. Degenerative myelopathy, where their legs are just starting to get weak over time, subluxation. Canine wobbler's disease, it's a wobble in a gait due to spinal degeneration in the neck, so they just sort of wobble back and forth when they walk. Hip dysplasia, another subluxation complex. In cats, now I'm not a big, I haven't adjusted a lot of cats. When I first learning this work, somebody brought me a kitten that was not doing well at all. It was failure to thrive is what you'd call it. Like that kitten was not far from death's door. And so I adjusted it 3 or 4 weeks, and about the 4th week, he was ready not to be adjusted anymore. He was doing really well, and I was ready not to adjust it. I just said, don't bring this cat back. Okay? So wry neck, where they just walk around like this, that's subluxation. The lameness, lack of leg strength, any kind of somatovisceral disease. Like when dogs, develop allergies over time, that responds well to chiropractic care for animals. So things to avoid in small animals after they're adjusted. You don't put them in cages and rest them, not good for them. Stairs should be avoided. So a lot of the animals I get, I have them not walk up and down stairs because that tends to throw them out of adjustment. And here's, like I said before, pets need to be prevented from jumping off couches, beds, and counters, jumping out of cars. Again, this is what I said earlier. So these are some somatovisceral diseases that are held in small animals. Bowel disease, thyroid issues, kidney disease, dermatitis, allergies, food intolerances. In large animals, lameness, gait abnormalities, lack of neck flexibility, poor performance, and somatovisceral disease. And I've adjusted horses, I've adjusted a goat. It's not hard. Hock disease, degenerative joint disease in horses, stifle disease, all kinds of diseases of the lower leg of the horse can be helped with chiropractic. Colic, ulcers, allergies, hives, head shaking, coughing. I had a horse that was a patient of mine when I was first learning this, just coughed all the time. And after probably 3 or 4 adjustments, it stopped coughing, completely stopped coughing.
Sure wasn't choked from bad hay maybe or something, or?
Well, I mean, it's eating the same hay, as it was before I adjusted it, so. Now bulls, I've never adjusted a bull, but their semen increases production 10 to 15% when they're adjusted. So that's money in the pocket for the owner of the bull. Okay, and how could that happen? Well, it's because the reproductive area in the bull is innervated through the spine, just like it is in a person. So we also do laser on animals. And animals respond really well to laser. So how does a low-level laser work? Same as a human. Interaction between the cells and photons produces what's called a photobiochemical reaction and affects the tissue at the level of the cell. And low-level laser enters the tissue, alters membrane permeability, absorbs the mitochondria of the cell, which are the energy production areas of the cell, changes, and it creates a change in the mitochondria, which produces energy in the cell so the cell can heal much easier. So if you look at the effects of low-level laser on a cell, rapid cell growth, faster wound healing, increased metabolic activity, reduced scar tissue formation. Scar tissue is just a cheap grade of fibrous tissue which causes a weakness in that area. Increased vascular activity. It stimulates blood flow into the area. Stimulated nerve function. It speeds the process of reconnecting areas that are numb to the nerve supply. And these physiological changes affect macrophages, which are part of your immune system, which attack viruses and bacteria. So the energy transferred to the cells from the laser increases mitochondrial energy production. So when you adjust an animal and then you laser them, it produces a very powerful effect. Now, for me, when I adjust, most of the people that bring me their dogs to work on, and here's the sad thing, is that they'll bring me a 14-year-old dog that can barely walk, and they want me to, sort of produce a miracle in that dog, so it acts like it did when it was 6. Well, I can't do that. I can help the dog a lot. It's better if I can see a dog when they're young periodically, because if you adjust an animal periodically throughout their life, they'll live 30% longer, and they'll be healthier during that 30% of their life. So you don't have to wait till it's on its last leg and then bring it to me after $2,000 worth of vet bills. And I can help those animals a lot, but I can't make them brand new again. Okay, so I just like with people, I believe natural health care first, pharmaceutical second, and surgery last. You can always do surgery if you need to. So we're going to adjust some animals, okay? Adjust some dogs. I'll show you how I do that. So we're gonna, let's see, who wants to go first?
I don't care.
You gonna go first?
Okay.
Okay.
Yep.
Okay. It's a small dog, so we're gonna turn it down to, here's what they're gonna feel. Okay, so first thing we're gonna do is just feel the atlas. And I can just feel the atlas of this dog and tell that it's out of adjustment. Okay, it's rotated a little bit, so we're just going to go right on the atlas.
Jewel.
Yeah.
That starts the noise. Once again, yeah.
There we go. That didn't hurt, does it? Okay. Okay. I like to do it on the table because it's hard for him to grab onto anything. There we go. It's okay. You'll get used to that.
No time to
Third
sue.
time, yeah.
Now that isn't exactly how they act when they have a subluxation. And now we're seeing it.
Let's see what
See that?
Yeah, see,
That's a subluxation right there.
and it's
Okay.
getting better already.
See that?
Yeah.
So this dog is definitely subluxated.
It'll feel a lot better later.
Man, you're gonna be like 3 now.
It's okay. Mama's here. Mama's here.
My butt.
There we go. I know, getting a little personal back here.
Yeah.
Okay, not too bad down there. Now we're going to do another pass. I usually do 3 passes. There we go. You're getting used to that now.
Mama's here.
I've only been bitten once,
Yeah.
and I bought muzzles after that.
Oh,
The dogs are the humans. Sorry, I said something. like
Of
that.
course,
Thank you,
of course, I know.
It was actually pretty funny.
Okay,
It was a dog. Okay. Yeah, see, this dog is
Now we're
very
cooking.
subluxated in his thoracic and lumbar
Much
area.
better.
How old is this dog? 10, yeah, I believe it. When you look at the amount of civilizations it has, yeah. You're gonna feel a lot better. You're gonna have a lot more energy when we're done here. Has it had any problems that you know? Okay.
She has a sore front left shoulder, but
That's definitely could be a subluxation issue. Okay.
that's.
Maybe it's starting to feel good.
Yeah. It's mostly the fear.
Oh, yeah.
Fear and the
It's
noise.
like trying to adjust a 2-year-old to
Oh, I
get
bet.
scared, you know. And okay, that's all there is to it. That's how I would adjust a dog. Okay. Okay.
He's glad that's over.
Yeah.
See what you
feel
mean
so
by
much
the
better.
noise would be more startling.
Yeah, that is kind of.
Yeah.
Okay. Now, does this dog have
You're
any
chasing
problems?
squirrels
Any
tomorrow.
health issues?
Right? Has
What's her name? Stevie?
Stevie,
Stevie. Like Stevie Wonder?
like Stevie Nicks.
Oh, Stevie. Yeah.
There you
Girl.
go. There you go.
Oh, but no, but
Fleetwood Mac, yeah.
Bladder infections and UTIs,
Okay.
and you changed her food and
Okay.
everything. So yeah.
So that's somatovisceral right there. Repeated bladder infections, urinary tract infections, probably somatovisceral. Okay, so let's see what we find. I've adjusted quite a few Shih Tzus, and they're generally pretty nice dogs. They didn't, this little bigger dog, and I turned it up a little bit. There we go.
Is that what that is? Is a Shih Tzu?
Yeah.
Okay.
without the facial hair.
It
Yeah.
looks healthy.
They just
Looks very healthy.
Hey, she don't mind it at all.
She,
Blinking, that's it.
Should be interesting to see what we find in this dog when we get down into the lumbar area.
Yep, doesn't seem to mind it at all.
yeah,
laid back.
she's so laid back.
See, now we're starting to get some
no big deal.
subluxation
Yeah, it's
patterns
like-
down
No
here in your
big deal.
Oh,
kidney
that's okay. Just don't take my dog for
reproductive area. So this is the kidney area of the spine right in here, and you can see how she jumped.
Did I feel
Yeah.
bad? Did you like that?
Another dog
Did you
that,
like that?
I think for her it was.
how old is this
All
dog?
the noise.
11.
If you could come up with a sound,
Okay.
I think that would
Yes.
be,
Oh, yeah.
you know, for
She would
these,
have been
for
mine.
these
The
listeners
noise.
like this, yeah.
Mhm. You get away from her ears and then she's not so.
Oh, yeah.
Is it easier
What's your
with bigger or
last
smaller
kidney
dogs?
infection?
I would think bigger.
2 months ago.
Okay,
Bladder infection.
bladder infection, yeah. So
Dr. Firnhaber, is it easier with larger or smaller dogs?
it doesn't matter.
Mm-hmm.
The larger dogs, of course, it's just it's a little easier to find things on them because their vertebrae are so much bigger.
Right.
Biggest dog I ever adjusted was a full-grown Great Dane,
Oh, yeah.
and there wasn't a lot of difference with that dog and a horse.
Not really.
It was
You can saddle them.
just about, yeah. And I had that dog muzzled, and I was glad.
Yeah. Yeah.
But it responded really well to care. Now, as I run through this dog here, little Stevie here, it seems like his subluxation pattern, it's a she though, right? Yeah, her subluxation patterns are getting a little better. I'm gonna do one more pass. Yeah.
So what would be the significance of doing the 3 passes with the animal as opposed to like when you adjust, one of your patients when you're using that similar tool?
Well,
On the patient.
animals are just different from people, and they just, you just, the only way that I can answer that question, it just works better on animals when you do it 3 times. That's not a great answer, but it's the best I can give you.
Well, it probably opens up neural pathways, I would think, and then after that, then you can kind of go in, and now that the dogs get a little more used to what you're doing, probably responds in kind. I suppose the third one's just to make sure it's all set in place.
Yeah, I have people that have brought their dogs to me a couple of times, and their dog will walk in, and when they see me, they want to turn and walk out.
Well, you're kind of like a vet.
Yeah.
I was wondering too, since dogs have 4 legs and we have 2 legs, and our backbone, our spine is more set up the vertical.
Sure.
Oh, you got a point, yeah.
There's
a
There's horizontal, yeah.
If that makes a difference.
Makes a huge difference.
That's what
This
I
is
was
this is a lot easier on the spine than it is when you're
Yeah, because
vertical.
somewhere gravity and there,
When
you
you're
got all your
vertical,
guts
yeah.
and everything, so it's
There's
like,
a lot of shifting, a lot of pressure.
Okay, I can just, what I'm doing is feeling the motion of the kidneys in this dog, and there are some issues there, so I'm going to laser it, give it a little laser love, and
Are there adrenals on top of the kidneys like ours?
yeah.
Okay.
Here we go.
I was talking with a guy not too long ago, and we were talking about animals and the number of stomachs. Cows have 4,
right,
goats have 4, sheep have 4. But you know, horses, they have 1,
right.
and they eat grass, just like cows and goats and sheep. Now, why does a horse have 1 stomach when their intestinal system can break down food, hay, and grass and all? Why do they only have 1 stomach and can get by, and cows have to have 4?
Well, I think you're asking the wrong person. You
Oh,
need to look
well,
up
You
when
need
you
to
ask
ask
the
God that question. I was thinking
I
that too.
have a
I didn't make those
classmate-
animals.
Yeah, you didn't invent animals. But I have a
It
classmate.
does make no sense, though.
It does. You know, why is a horse different?
Yeah.
You know, they may have a lot more stomach acid
They're not a
in
creditor.
order to
yeah.
break down that. They may just naturally have more acid. in
They have a
their
lot
stomach.
more attitude, I'll tell you that, from personal
Well,
experience.
Yeah. Yeah, they have a mind of their own.
Wow.
Not just start
Look
doing
at that dog.
Mhm.
just like you were saying.
Dogs cool themselves.
Okay,
by
her
breathing.
now. I'm getting a much more normal motion right now since I laser. Yeah, so good. You're all
Man,
set.
you're all good to go.
Yeah,
Stevie.
this dog need to be adjusted. Yeah.
We're going to
Good.
be bringing her back tomorrow.
Yeah.
Now the question is how often do animals need to be adjusted? Okay, so let's say if you have a pretty acute problem, you only need to adjust them once a week and maybe laser them an extra time in between. So adjust them once, see again in a week, and then again in 3 weeks. Again, depending on the problem. Then again you can wait another 3 weeks. And so within like a 3-month period of time, you might adjust the dog 6 times, 7 times maybe. And then if they really have some issues, and laser them in between that time. You don't need to see them as much as a human. You know, humans I need to see a lot more. We're pretty hard on our spines. Dogs, animals, not quite as much. So, any other questions? I can't answer the question about the stomachs.
Have you noticed a difference, or rather have your pet owners noticed a difference in the animal's overall behavior especially if they interact with other animals, if they're multi-animal residents, for instance, and after they've been adjusted, after they're feeling better, not just maybe how, their level of activity, how they're walking, whatever, how they're responding.
Attitude.
Just attitude in general. Have you noticed, have there been any difference in their general attitude? So I know, we get adjusted, I always sleep great that night. It's always a magical sleep that night for some reason. My attitude improves, obviously, if I have less pain.
Mm-hmm.
So do you think the same thing with animals? Have you noticed anything with behaviors? If there's like a multi-animal family?
What pet owners have told me is that, number one, the sleep issue, they sleep better, they sleep more soundly, they don't get up as much during the night, and the animals are generally overall calmer.
Calmer.
That's what I get, okay? So I get from owners, okay? So, yeah, as far as their interactions with other animals, nobody's ever said, well, my animal stopped, chewing on the neighbor's chihuahua, since you're adjusted. I've never heard that. But
Maybe you should ask.
well, I say that from a very bad experience I had when I was in high school, and I owned a German Shepherd, and it chewed on someone's chihuahua, and it wasn't pretty. Okay, so no, but those are the things that I see, and another thing that I hear is that the animals get up and down better, they have more energy, that type of thing. But I haven't heard anything about interaction with other animals. Haven't heard anything about. Nobody's ever said anything about that.
Obviously, you mentioned earlier that your age factor in animals is going to make a big difference. Obviously, but say you've got a middle-aged cat, for instance, or a middle-aged animal.
6 years old.
6, 7, 8, somewhere around in that area. It can still be beneficial for that animal, right?
Absolutely.
As far as what will change for them.
It's prevention. Just because the animal doesn't have a problem, why not prevent it? Why not prevent problems? So,
Sure.
In other words, when you clear up the vertebral subluxation complex, you're preventing that animal from getting sick or having problems down the road.
Okay.
And in our culture, it's we have this, if it doesn't appear broken, you don't fix it.
Right.
And so we don't do that with our cars or houses, but we do with our bodies, And so same with an animal. People think, well, it's okay, why do we need to do anything? But if you just clear up those vertebral subluxation complexes, that animal is going to be healthier. It's going to live longer. It's going to, you're going to get a lot more out of the animal. It's like these bulls. They produce more semen when they're adjusted, and they don't have. They're not complaining about migraine headaches or anything like that. They just perform better.
Heifers,
So yeah.
I noticed up there you mentioned earlier it said cat food. It said wet food only, no dry food. Why?
Just because that's the way cats are made. They're not made to eat dry food. Look at what they normally eat. Look what they eat in the wild.
Sure.
They eat raw food.
Yeah.
Yeah.
Mice and rats and voles and
Squirrels,
birds and
yeah.
whatever.
That's what they eat.
Question though, how do you how do you get them to eat certain food? It's like I've been owned by cats since I was like 9 years old, and I can't say I've ever met a cat that liked a certain type of wet food enough that it just didn't go crazy when the crunchies came out.
I don't know how to answer that question.
And the vets can tell you, well, they'll eat this, and it says no, they won't. They won't eat any vet food. I always wondered about this. Like, what are you supposed to feed them then? Just starve them to death, or
No. Friskies. Our cats are
any of that?
Friskies.
Well, actually, that's dry food though. Once you talk about the Friskies wet food.
I'm talking about the canned Friskies.
Yeah.
For $1 cans.
Yeah.
Maybe you could mix the wet food and the dry food together.
Yeah,
Because
that's a good idea.
I've never owned a cat,
Wow.
so
Wait, have we got a
Yeah.
cat for you?
Mix your dry and your wet together. And if you got a can of chicken, mix that with your dry cat food, and they'll go
So some of them though, like Kelly, you can't mix the two. They can have wet, they can have dry, but you don't want them to eat one on top of the other. They'll throw it right up.
Oh,
Yeah.
There's that too.
Oh.
I don't know.
I don't
It's
know
one
what
of
to
those
say
things.
about it.
It's like they always said, you never give them.
Yeah.
Yeah.
Never give them treats, or you never give them Friskies, whatever, or Meow Mix, or any of that stuff, because it's kitty Fritos.
Yeah,
It's what the vets say. It's kitty Fritos.
Oh,
You know how
so
Fritos are. You open a bag of Fritos, you can eat one.
the
Yeah,
mixes, yeah.
I
I
dare
thought
eat
good
one
for the
Frito.
cat.
Yeah.
So I'm thinking it's possible, this is just throwing this out there, that you could, I'm wondering if you adjusted a cat like that, if it would change the food that it wanted to eat. It's possible.
That is a good question.
You know, I don't know, because I've never done it, but that's one possibility. You know, maybe it's subluxated and
They
just,
tend to be a lot more picky than dogs are.
Yeah.
I've had both.
They're
Certain
finicky.
dogs.
Yeah.
Dogs will eat just about anything you throw in front of
Very
them. Cats are
finicky.
like, man,
Yeah, they'll eat just a little bit at a time.
this, and then they might get tired of that. They, well, I don't want to eat that anymore. So now you switch from the shreds to the pate.
Yeah.
Mix with some water.
Yeah,
and
mix and all that.
then they want the chunky, you know, they want the gravy.
Gravy train, yeah.
well, you know, like I said, you might want to just get the cat adjusted and see if it changes anything. Because they may be neurologically impaired, and you know, like I said, animals get subluxated,
Sure.
jumping around, and just like we do, you
Yeah,
know,
because
and
you notice you'll see them limping or something. It's like, so